I'd never heard of SCAD before. I've only ever heard the umbrella term heart attack. Didn't know how many different variations there were. The pain did become incredibly strong and was moving from my chest to my arms and my back. It felt like an elephant was actually sitting on my back and not my chest in the way that you typically hear. And I was with my husband and my son, who was 6, and I collapsed to the floor. I was certainly very scared about what the next moment would bring. It crossed my mind that I, might not live, because I just didn't understand what was happening.
When we think of heart attack, we oftentimes associate with blockages in the coronary arteries and stents and open heart surgery. That is absolutely the number one cause of acute coronary syndrome or heart attacks in the United States. However, there are other types of heart attacks, including what Kelli has, which is SCAD, spontaneous coronary artery dissection. And if you don't think of it, you will miss it.
So my husband called the ambulance. The ambulance arrived, and they were at first confused as to which of us was experiencing the chest pain.
Women do have oftentimes atypical symptoms of heart disease. And I think the goal is, between the patient and also physicians and having these conversations that we can improve detection, improve treatment.
Their initial assessment was that it looked good and that it might just be a panic attack.
This was not just a panic attack. She came into the emergency department. Her EKG started to become very clearly abnormal. It started to show signs of a heart attack. And her troponin, which is one of the blood tests of the heart, was not only abnormal, but it started to increase at a very, very fast rate. And in an otherwise healthy 38-year-old, our question was why? And it was a conversation that happened between our Phelps colleagues and our cath lab. Could she be having SCAD, or could she also be having a blockage that needs to be opened up with stents? And the only way that we would be able to know that is to do a cardiac catheterization. 80 to 90% of patients with SCAD will have spontaneous healing of that tear just with medicines at 30 days. So within a month, 80-90% of these tears will heal on their own.
Dr. Sopti did explain that cardiac rehab also reduces the risk of recurrence, and it was something I had in my control to be able to work toward recovery and getting and feeling better and more confident.
So her arteries have healed, her heart function has healed, and I think symptomatically she feels much better. So I think across the board, there's nothing more that a cardiologist can hope for than, my patient to feel well, to function at her best, to feel at her best, and also just having regained a sense of normalcy, that she can go about her life, be a mom, work full time, and really have a meaningful quality of life after, a potentially traumatic event.
Nice and relaxed, 104.62.
Thank you. Perfect blood pressure.